Revelations, meanwhile, about U.S. President Donald Trump and what he knew about COVID-19 are raising new questions here at home. A new book by Bob Woodward reveals Trump was aware of how deadly the virus was as early as February 7th, but downplayed it to prevent panic. So given the level of intelligence sharing between the United States and Canada, did the government here do the same, or was Canada slow to receive the facts about COVID as it spread globally? The CBC's John Paul Tasker has been looking back at those early months. He joins us now from Ottawa. Hey, JP, great to see you as always. Tell me a bit more about what you dug up.
Yeah, so there's been so much talk about Trump concealing some crucial information about COVID-19 from the American public. So I decided to go back and see what Canadian officials were saying at the same time that Trump was talking to Bob Woodward for his book in early February. As you know, Vashti, there's extensive intelligence sharing between Canada and the United States. There's always information crossing that border about a whole host of different things, including healthcare matters. And it's clear that the Canadian officials in charge here in this country were downplaying a lot of the risks associated with COVID-19 in the early months, because it was already well known in the United States that COVID-19 was essentially airborne and that it was a lot more deadly than the flu. And that is not the message we were getting from the likes of Patty Hajdu, the health minister, or Dr. Theresa Tam, the chief public health officer in this country. In fact, it was really quite the opposite in terms of their public messaging about the risk to Canadians. So I did go back and look through some of the interviews you did with Hajdu in this early period to get a sense of what they were saying at the time. I want you to listen to one clip in particular. You asked Hajdu about what the government was doing to support provinces and territories prepare for a possible spike of COVID-19 in hospitals. Take a look.
I think it's very premature to say that there would be additional resources needed at the hospital level. Every indication is that we will not at this point in time.
She also said in that very interview that she thought Canada was phenomenally well prepared and well coordinated. Of course, we'd learned that days later, the public servants in charge of the National Emergency Strategic Stockpile were warning Hajdu and other senior public health officials that there just wasn't a lot of personal protective equipment on hand. They did not feel like they had enough N95 masks, for example, to go to the provinces if there was a sudden spike, which we know would happen some 6 weeks later. Also a disturbing clip that was given by Hajdu on your program as well at the same time. She was asked about asymptomatic transmission. We know that Dr. Anthony Fauci, who of course is the foremost expert on infectious diseases in the United States and a member of President Trump's COVID-19 task force, he was up at the end of January saying there could be no doubt that asymptomatic transmission was among us, that it was possible for someone who did not have symptoms to pass it on to another person, citing groundbreaking research from a German researcher. And here's what Hajdu had to say about that sort of research. Take a look.
The science is still quite weak. There are some reports, but the World Health Organization does not believe at this point that the virus is contagious when people are asymptomatic.
So you see, she's consistently saying this is weak science and deferring to the World Health Organization over our closest ally, the United States. And of course, we know at this period, the WHO is a lot rosier in its outlook about COVID-19 than the United States, or at least some officials behind the scenes were. And speaking to Trump, I should add, Vashti, it took 66 days for Dr. Theresa Tam to state publicly what Dr. Anthony Fauci said on January 31st, namely that she did believe then that there was asymptomatic transmission, which of course we know there was. That's why there was so much community spread ripping through our country in March and April.
So I know, JP, that you put a lot of this to the government. What is their reaction now?
Yeah, I did ask for comment on all this, and I wanted to get a better sense of what Hajdu did know in the early parts of February when Trump was speaking to Woodward for his book. They didn't give me any comment. They did refer me to what she said on your show last Thursday when you pressed her on when she really knew this was so serious. Look at what she said then.
Well, absolutely, we knew it had the potential to kill a lot more people than the flu. We knew that there were lots of things that we didn't know about COVID-19, and of course, we've learned more and more as science has researched and understood the virus more and more. We have all taken this virus deadly seriously. We started meeting at an officials level and at a political level early January to make sure that we could be as prepared as possible and to put into place measures that would protect Canadians. And I think, that's the approach that we've had from the very beginning.
So she said she took this virus deadly seriously. Well, the opposition is poking some holes in this, calling it disingenuous, because what she's saying now is so out of step with what she was doing the pandemic. They're also picking up on something she said on your program, and she really pointed to extensive screening at the airport to justify her position that the government was taking it seriously at this point. Well, we know that's really just not true. The government did not start collecting personal contact information from travelers coming from Wuhan and Hubei province until February 18th. In fact, there was 58,000 travelers from China between January 22nd and February 18th. Only 63 of them were pulled aside for further screening. So the opposition is saying the government really bungled all this, and that's in part why we have 9,100 people dead in this country. Vashi.
Okay, thanks so much, JP. Appreciate your work on this one. JP Tasker in Ottawa.